We now want to bring in Dr. Atul Gawande of The New Yorker, who asks, is healthcare a right? In this week's issue of the magazine, out tomorrow. Welcome. You, for this piece, went back home to report on healthcare. Why?
So back home for me is in southeastern Ohio, and I went back home because this is a territory that's I grew up in a blue dot, Athens, Ohio, in the middle of a Red Sea. We went for Trump, and my friends, I went and spoke to them to ask them what they thought. Do they believe healthcare is a right? And a surprising number said no, even friends who'd been bankrupted by healthcare costs, because they believed that it was really a way to ask them to pay more for other people while they couldn't afford their healthcare costs. So they weren't hearing that it was a way to help them.
Now, in the debate we're in this moment, I just want to step back a minute. We're not even asking really that question, are we? I mean, over, say, Graham Cassidy, that's just not being asked, is it?
That's right. It's disconnected from the goals and the troubles that people have now. You know, the criticisms on the show are legitimate. You know, the people I talk to, friends who are still earning less than $20 an hour after 20 years in a job, are sending half their paycheck in for taxes and paying for a premium for crappy insurance that's $3,000 deductible, $50 copay, and meanwhile their taxes go to pay for someone who may not be working, who has Medicaid coverage that is better than anything they could dream of. No copays, no deductibles, no premiums. Now, the interesting thing to me, though, was that they distrusted the government to solve this problem, but they also were strong supporters of Medicare, and understood perfectly well that it was a government program. The key thing that they saw was that Medicare wasn't about a right. It was about the idea that we all contribute, we all pay our tax in, and we all benefit, and benefit fairly. And right now, for what we see is everybody gets an astonishingly different deal for something as important as their health care, their health and survival.
So essentially the difference is Medicare, no freeloaders, because everybody's got to pitch in and they're worried about the freeloader problem.
That's right, and that everybody's in the same deal. The broken part of the system, the thing that we don't talk about, is that the link that we have made that you get your health care through work is breaking. That link is breaking because it leads to very different deals. We have to create all these systems for what if you're disabled? What if you're in a small business, can't afford it? What if your employer doesn't cover you? What if you're self-employed? Second reason it's breaking, 94% of net job growth since in the last decade is in jobs that are that don't come with health benefits. It's freelancers and temporary workers, independent contractors.
So given the reporting you've done and these differing views, as you said, even for people who've been bankrupted and had to scratch for 5 years to get back on the right side of an illness, is there a solution, a bridge that you found between the different groups?
Well, the fact that people see in Medicare their values being enacted suggests our pathway forward. The critical parts of it is building trust in order for that bridge to get there. So what people don't talk about, you know, what one person said to me is, the left doesn't talk about the cost and the right doesn't talk about the need. And none of them want to talk about how do we transition to getting there. There are approaches. You can transition to making sure that outside of work you can get coverage through Medicare. You have a state like Nevada that passed, but the governor vetoed, letting people buy into Medicaid. Or you could say healthcare.gov, make that the open system that we can all buy into, pay into, and share equally in being able to get that kind of coverage. We have to stabilize. I agree with both the Republican and Democratic view that you need a bipartisan effort to stabilize the current system. Now, there's actually straightforward ways to do that. In the Senate, Alexander and Patty Murray effort to make that happen is a critical first step. But then you have to build and do the thing we're not doing now. The message I heard from people is that it's the public debate and also the public hearing process around solutions like allowing buy-in or transitioning to allow states to make this passageway.
Help people understand what stabilize means for the Affordable Care Act, because they may not understand what that means and why that's important.
Yeah, I mean, all the things that people are pointing to right now, premiums are going up. Why are they going up? Because the insurers are uncertain. Is the government going to enforce the mandate? Is there going to be subsidies to ensure that people who can't afford their deductibles, that they aren't bankrupted along the way? Those basic components haven't been nailed down. There's total uncertainty what's supposed to happen. And providing some certainty brings the premiums down. There have also been programs that people have tried everywhere from Minnesota to Alaska that have allowed for reinsurance plans that allow for the very high cost patients to not end up driving up the cost of a single insurer. Right. So there are some technical approaches that allow you to smooth out the costs and stabilize where we are now. It clearly, though, is only the beginning pathway to being able to open up the system that deals with the fact that job-based coverage is breaking.
Final question. You mentioned a lot of different states, Minnesota, Nevada. I know you've written about different efforts in Wisconsin. This is the Republican argument, that the federalism, let 50 experiments bloom and let that work. So it sounds like there's nothing, that may be a good approach.
There's nothing inherently wrong with that. I look at this, I'm a surgeon. I have mainly a cancer practice. Before reform, 1 in 10 of my patients were uninsured. And then after they had their diagnosis, they now ran into having pre-existing condition exclusions. I, since reform, have seen no patients who face that problem anymore, 0. Now, any of the approaches that we have, whether we want to push it to the states or want to, and say the federal government's going to get out of this responsibility but hold the states to certain standards, or that we're going to try to open up Medicare more widely, any of those approaches need to ensure that we are clear about a line around the core values of people we're talking about. What are the costs to everybody? Are we sharing in the burden equally? And then how are we transitioning so we don't hurt people along the way? We are at risk in every plan that has come forward right now. We end up making people in the system worse off in the name of supposedly making it better.
All right, Atul Gawande, thank you so much for being with us. And we'll be back in a moment with our panel.